You think Jim has a stressful job? Well, speaking of stress, I want to try a little experiment here. When I count to 3, I want everybody who has stress in their job or is anticipating it to reach to those light fixtures up there as high as you can, and using your outside voice, not your inside voice, I want you to yell, help. All right, here we go. 1, 2, 3. Help! All right. Wow. Well, now that you've so politely asked, we have a great panel to talk about stress, sanity, and sensibility. I'm Marjorie Doyle. I'm a former Chief Ethics and Compliance Officer of the DuPont Company, and then of an oil and gas services company called Vetco, who had a little problem with the government. I am currently one of the managing directors of Aegis Compliance and Ethics Center and of Counsel to Meade and Roach, and am a member of the advisory board of SCCE, Society for Corporate Compliance and Ethics. Now, I could take all morning to talk about these 3 distinguished panelists who are going to share their wisdom, but I couldn't do justice to it. So they're all board members of HCCA. So you can certainly go online and see the details of their glorious careers so far. First, how lucky was I to get Shawn DeGroot? Today's her first day as president, and yet she has time to be on this panel. She is VP of Corporate Responsibility at Regional Health in Rapid City, South Dakota. She has all the highest HCCA certifications and 27 years in the private and public health care experience. Welcome, Shawn. Down at the very end is Dr. Bob Ossoff, who is also on the HCCA Board of Directors. He's currently Assistant Vice Chancellor for Compliance and Corporate Integrity at Manus, and Manus Professor of Laryngology, right? Close enough?
Close enough.
He's a throat specialist, all right, at Vanderbilt Medical Center. He's board certified and has had numerous leadership positions in this profession. He has a graduate certificate from George Washington University in healthcare corporate compliance. Last but not least is the infamous Dan Roach, who's also an HCCA board member, is also co-chair of the SCCE and a member of the advisory board there. His day job is as Vice President, Compliance and Audit for Dignity Health, formerly Catholic Healthcare West. Y'all aren't familiar with organizations changing their names and titles, are you? He is responsible for the compliance program as well as internal audit, relationship, and defense of investigations. So, with that, I'm going to move over here and let's get started. Now, Roy has already set us up this morning and told you about the January 2012 survey of the HCCA and SCCE membership around stress. And if you haven't downloaded it from the website, please do so, because there are some interesting learnings. Roy mentioned some of them. Clearly, the bottom line is the profession is under stress, and there are some details. One of the questions was, which of the following causes you the greatest stress? And the greatest by far was keeping up with laws and regulations. Others were identifying risks, preventing compliance violations, detecting, investigating, and remediating the violations. So basically, just about everything in our profession. So, Let's turn to our experts who I've added up, and I think amongst all of us, we have well over 100 years of experience, or what I like to call scars on our back. Now, I've just read what the survey says, and I know you're all on the board of HCCA, and Roy says you've been talking about the survey. What do you think, do you validate what the survey says, and maybe something more deeper? Do you have something beyond what the survey says about stress? Who wants to get us started? Dan, you're smiling, do it.
I'll get us started. Clearly, keeping up with the laws and regulations is a real challenge. And for a long time, both first as a lawyer, then as a compliance officer, I spent a lot of time trying to keep up. I still try to keep up, but I think the most profound thing that I learned shortly after I came to Dignity Health in 1998 was that if I really wanted to do a good job in the organization, I needed to surround myself with good people. And I view myself as a person of limited skills, but one thing that I think I've been very fortunate to do is to surround myself with exceptional people. And many of you have heard me say this before, but if you really want to cut your stress down, hire people smarter than you and listen to them. And it will make you much more successful. And I know that I've had the privilege of working with people who have tremendous amount of experience in healthcare. As a lawyer, and I can certainly relate to what Jim said, I have come up with a lot of brilliant ideas on what to do from a compliance perspective, from an ethics perspective, even from a legal perspective. But when I sit down and talk to somebody who's been a nurse in a hospital, who's run departments in a hospital, who's been an assistant administrator, and now who I have the privilege of working with on my staff, she'll look at me and she'll say, Dan, what are you thinking? That's never going to work in the real world. Or someone else on my staff who's run a home health agency and has been a nurse on the floor, or someone else who's worked in a billing office, worked in a physician practice, coded claims for many years, tried to manage physicians, and I really rely on those folks to really help me out and to ground me. And I think more than anything else that I've done, I feel like to reduce my stress in a job is to learn that you have to hire people smarter than you are and listen to them.
Great. Shawn, how about that?
Well, I'm going to comment on structure and process, because if you don't have the right structure, it's going to self-induce some stress. It's inherent upon the compliance officer to build relationships, and those relationships are going to help you with the success of your program. But if your structure isn't there to support what you need to do and work in an oversight role versus operational role, you're going to have many hurdles and challenges. I've heard from many compliance officers the past couple days and the past several years that if they're not reporting directly to the board and there's a layer between them and the board, it makes it very difficult to carry a message and communicate and help them with their fiduciary responsibility. And I think it makes it more difficult. They feel more isolated and stressed simply by the structure.
Okay. Bob, what's your top one?
Well, I agree with Dan and Shawn both. I came from a career as a microsurgeon and take care of people's voices. That was stressful, especially when the voices, garnered many millions of dollars a year out there in concert. I've been a parent. That is stressful and certainly more challenging than microsurgery. I have to admit, being a compliance officer beats the other two by far. And instead of waking up 4 o'clock in the morning thinking about an operation I'm going to do at 7:30, you wake up and be worried about so many different things. So a piece of advice, and I agree with Dan, surround yourself with people that are smarter and better than you. Give them resources, point them in a direction. One of the hardest things to do is to not get in their way and try to micromanage. Let them do their job. I think that's key. Another is you can't solve all the problems on your plate in 1 day, 1 hour, or 1 minute. You can't even do it in a month. So learning to prioritize, learning to create an image on that plate where you get dividers. Maybe there's 16 dividers or 8 dividers, and you're going to focus on A, B, and C this week, this month. And realize that if you do that, you can manage your stress far better than looking at 16 problems and thinking, how am I going to do this all at the same time? That's why you have a staff to help you to look through this.
These are all great comments, particularly somebody new to the job. I've heard so many times somebody new come in and go, okay, I'm going to get this turned around in 6 months. All right. So what do you say to somebody like that?
I'd love to take that one first.
Okay, go for it.
You know, I'm a cut it out and fix it type of person. I'm a surgeon. So make a diagnosis and move on it and get it corrected. So that has probably been the most difficult thing for me, is to identify these problems and realize, gosh, this is not an event to fix it. This is truly a process. And to get to accept that, especially coming from where I came from, and continue to still do a couple operations a week, has been a huge challenge. But you have to realize that you can set goals for yourself, such as the 6 months, and someone, hopefully your colleagues, your friends somewhere, are going to let you know that if you create, goals that you can't achieve, they're unachievable, then you're going to be the most disappointed human being in the world, disappointed compliance officer, and that disappointment just feeds stress. So I think creating realistic goals is critical. 6 months, you can't do it in 6 months.
Good.
I would agree. I think 6 months. I had a CEO was enthused that I joined the organization, and he told the board, Shawn's going to get this turned around in 6 months. He said those exact words, and I about passed out. It's like moving the Titanic. I mean, and there's always things to do. There's new rules and regulations. The job is never done. So you can make change, you can make a difference, but you can't get it all done in 6 months because it's never done.
Well, speaking of that, people putting this on you, like, oh, you're now going to fix everything because you're ethics and compliance. Dan, you were talking to me about something you do to change that. In other words, you don't accept that burden. You talk about business taking that. How do you do that?
I think it's very important, and this was a lesson, again, that took me a while to learn, not to take ownership of every problem that comes my way. And all of us have dozens of things that come across our desk every day, dozens of problems, and there's a temptation, and I find it in myself, there's a temptation in the staff to say, we need to fix this problem. And we just don't have the resources. And my view is that when we find a problem in a business unit, we need to sit down with them and say, okay, here's the problem that we face. How do you propose to resolve it? What do you propose to do to fix it? Because my job as a compliance officer in the organization is not to be responsible for compliance. Dignity Health can't pay me enough to be responsible for the behavior of 55,000 employees and 10,000 physicians. My job is to help management understand what needs to be done, help give them the information perhaps that will enable them to do it more effectively, and then monitor how well they're doing it. And I'm willing to give them advice from time to time. I'm willing to help them out, but it's their responsibility. It's their responsibility to implement the corrective action plans. It's their responsibility to develop those plans in the first instance, and it's their responsibility to make sure that whatever controls we've put in place, whatever processes we've put in place are followed. My job is to monitor it. And I have to tell you, I would much rather be a compliance officer right now than a hospital president. In my view, that is a darn difficult job, okay? And so I want to be sympathetic. I want to give people the time to do it, but it's really their responsibility, and I'm not going to take on that responsibility.
Well, and I take it that just saying this to the business once is not enough. That they maybe don't want to hear that it's not their responsibility because it's easier to have it be Dan's.
It is easy for it to be my responsibility, but you need to push back. You need to push back constantly, and I've been doing this for 14 years at Dignity Health, and I'm still pushing back from time to time. But stick at it, stick with it. It gets much easier as you go forward, But it's going to take some time. Again, it's not a 6-month proposition.
I think Jim made a good point, too, his analogy when he identified a problem, or his office did, and then some people took it upon themselves to take off and do emails and fix, components of it, but then they don't communicate with the compliance officer that they're working on it. And then on the other end of the spectrum, you have corrective action creep, what I call corrective action creep, because they expect the compliance officer to fix everything. And then when you find one issue, you've usually opened up a can of worms and there's 10 others behind it. So you get into corrective action creep.
Right. All right, you've all talked about surround yourself with good people and good resources and all of this, but I noticed in the survey that one of the points of stress is that's great and fine for you to say these resources, but we don't have enough resources. And I'm not in a position to be able to get those resources. So what's the answer to that? Not enough resources. And I don't know the exact numbers, but I think it's close to 60 or 70% of you think you don't have enough resources.
So no matter how many resources and how much resources, how large your budget is, it's never large enough. And so the first thing is to just acknowledge that. And then the next, again, I believe it's prioritization, to try to make do with what you have by prioritizing what's realistic to accomplish, and set that out as your work plan on an annual basis, knowing full well that, hot issues are going to come up, I don't know, 30 hours a day, 8 days a week perhaps. And you have to be able to deal with those hot issues when they come up and reprioritize. So flexibility in my mind is key. Going back again to what I said earlier, just the acknowledgement that you're not going to have enough resources, but to try to obtain help from other areas of the organization. There's so much overlap, if you think about it, between human resources, between risk management, quality, and other areas, and trying to, work with all of them, and they want to work with you as well. So being flexible to allow yourself to collaborate with other areas of your organization to get the job done. Now, at a large place like Vanderbilt, that's possible. At a small rural community hospital, it may be that the compliance officer is the quality officer, is the person that gets ready for the Joint Commission review, looks at risk management and everything else. So how many horns does a unicorn have? Certainly not that many, but one has to work in that direction to try to get things done. The other is, in a world where many work with physicians and always say, God, if it weren't for the physicians, my job would be easy. Yeah.
No offense, Bob.
No offense, right?
Yep.
Yeah. I used to be one of those. Still am.
You're reformed. You're like Jim Sheehan. Oh,
Exactly.
look, on the other side now.
Physician turned compliance officer. Oh my God. Targets on the front and the back. Well, my advice, ask some of your physicians how they might improve or how they might offer to improve the compliance program. Some of them are going to give you pretty good ideas because physicians are good, clear thinkers. Sleep on it, come back, and say, hey, I liked your idea. I'd like to implement that. Can I get you to help me? Guaranteed, 9 out of 10 times, if you implement their idea, they own it. And you put them in place to be your person, your physician champion. And that's how you recruit them. And that works 9 out of 10 times.
So, Shawn, I know you have some opinions on this, because in our discussions earlier, you thought one of the big stresses that maybe wasn't specific in the survey was this tension with physicians, and you see that continuing.
That's right. And I'll go back to my point on structure. I think compliance officers get faced with meeting a physician for the first time when they get to deliver the news that they have a 70% coding error rate, and it doesn't meet medical necessity. And we're writing off all these bills because of rack audits for short stay observations. So your first encounter with the physician is not on a positive note. I think there's a lot we can do to alleviate stress for compliance officers if the organization sets up a structure, kind of like Bob Ossoff is talking about, where you get to meet them on a positive note. How many compliance officers get to meet a physician when they're brought on board in orientation? How many compliance officers get invited to the physician's strategic planning? How many compliance officers are invited to their retreats, to social events, maybe to a dinner with the administration? When they have the chief operating officer, the CEO, I think it'd be nice to have the compliance officer at the table and get to know them on a personal level, because you build that relationship, you build trust, then it's going to be a lot easier to go in and say, hey, Bob, guess what? You were at 70%, now you're at 77, we still have work to do. I know he would listen, because we've already got a relationship. So that is one opinion. The other thing is, oh, do you want to say something?
Well, yeah, I was going to say, may I say something?
Sure.
So, you know, I think that one thing that compliance officers need to do is to know your audience. And, you know, I had to learn how to take care of country singers' voices. When I moved to Nashville, I used to take care of the voices of the lyric opera, totally different. They were trained. So know your audience and realize that physicians are used to getting A's and A pluses. And other than perhaps a driver's license exam at age 16 and a marriage or two during residency, they're not used to failing. And so for you to go in there and tell them that they got a 70% and failed, oh my God, they don't know how to deal with failure, because if they could deal with failure, they wouldn't be physicians, because you can't fail and get to be a physician. The bar is too high. So instead of letting them know they got a 70% and fail, I mean, I've instructed our staff to say, Dr. Ossoff, we've reviewed your audit and we've found some really good opportunities for improvement. And we can help you to document better, to create better patient satisfaction, to get more money back on your work, and you go down the line like that. And the message is how it's delivered. They buy into opportunities for improvement, but they sure don't do well being told that they've failed.
So learning to deal with divas, that's what you're telling us. Yes.
Yeah, that
Am I
will
right?
work, you know. Yeah.
Well, and we don't want to I'll jump on physicians, because everybody in your organization will have divas, whether it's your CEO or whether it's anybody else in your organization who is not used to failing. And if my add, being told that their you-know-what doesn't stink, okay? So how we deal with them. Now back to the structure thing, and I'll play a devil's advocate. It would be great if we had that structure, but once again, it's not always easy to push that structure in an organization. So I understand that we want to work towards an organization where the compliance professional is at a high level and doesn't have the stress of those intermediaries. But I like some of your suggestions, Shawn, about what you do in the meantime. At least try for those relationships any way you can. Dan, have you had that in your career, being able to do that, or have you always been able to walk right into the board?
Well, I have been fortunate that I have, for most of my career, been able to walk right into the board. But on the other hand, I've had a challenge, perhaps, that many of you faced, where I've been in large enough organizations where I don't have the ability to get to know all the physicians. I don't have the ability to get to know many of the players. And from a resource perspective, I feel constantly challenged. And I know all of you feel challenged as well. But I would ask you a couple questions. Number one, if you were to talk to your peers in your organizations, people who run other functions, how many of them would say, we don't have enough resources? And I suspect they would all say that, or virtually all of them would say that. That's certainly my experience in my organization. So we're all in this together. We're all facing the same challenges. The second thing that I would do, and this is a question I'm constantly asking myself and asking my staff, what are we doing that someone else should be doing? That someone else may be the operations people. That someone else may be the chief nurse executive, the chief operating officer, those kinds of folks. It may be the legal function, it may be the HR function, maybe internal audit, whatever the case may be. And I want to make sure that I do whatever I can to stop doing their jobs and allow them to do their jobs, to partner with them, and to make sure that it gets done in that way. One of the most difficult things for a lawyer who becomes a compliance officer, in my view, is to stop being territorial. As lawyers, we want to control everything, okay? We want to have all the information, we want to make all the decisions, we want to make sure that we're in charge of doing everything. I found out fairly quickly when I became a compliance officer, when I became responsible for compliance, that I couldn't do that. And so I have to trust the HR function. I may have to help them. I have to trust the legal department. Occasionally I have to help them. I have to trust internal audit. I have to trust our operators, things of that nature, to get things done. Now, again, my job is to monitor how well they're doing and to report on how well they're doing. Okay? And if I keep that mindset, I think, number one, it reduces the stress of sometimes not having enough resources, but it also pushes the obligation back to someone else. And I make it very clear, and I've made this very clear now for more than 20 years, I'm not responsible for compliance in the organization. I'm responsible to manage the program, but it's management's job to get it done.
Right. Okay, and maybe this feeds into going back to responses on this. The biggest, when you talked about what causes you the greatest stress, the number one was keeping up with new laws and regulations. And I think highlighted in the healthcare industry. And I think so many of our professionals feel like they're on a treadmill. And just when they get one down, here comes some more, and now I have to do that. All right, so how do you manage that expectation? Okay, how do we keep up with those? Are we supposed to keep up with those? Who do we share the pain with on that? So what are you going to do about that stress? That's 24% of the stress out there.
Well, I think it's everyone's responsibility to keep up with the rules and regulations, not just compliance, not just the compliance officer. And it depends on the program area. You should have subject matter experts in every field. If it's about vendors, materials management needs to assist. If it's about something to do with contracts, then legal department needs to help. So while we can all lose sleep at night not keeping up what is out there that we should know about, just relax and realize you'll never know it all. You'll never be able to read all the laws, and pick your priorities, as Bob had said, and prioritize it by risk.
So I agree with Shawn. Shared accountability, and what Dan had said, that we're not operations. We take a look and make sure things are being done correctly. And by the way, that is infinitely hard, because oftentimes, maybe all the time, you feel that it's sure easier to fix it than it is to sort of tread water while someone else is fixing it, and you have to babysit, okay, being a parent, to make sure it gets done. But shared accountability, leaders have a responsibility to know what the rules and regulations are for their area. And I think one of the things you have to do is remind them of that expectation and shared accountability. You can be there to consult with them, but it's their responsibility to know when rules and regulations change, because they're getting paid for that particular area of oversight.
One of the things that we've done in our organization, and again, I've been fortunate to have some resources, but I have a person whose job it is, and I feel sorry for her on the one hand, because she's a wonderful talent and she's very good. On the other hand, I've given her a lousy job, which is to review the Federal Register virtually every day of the week and identify what's coming out of CMS in terms of regulatory changes. And she does a wonderful job. She identifies the regulations, the program memorandums, the transmittals, or whatever they call them nowadays, I even forget. And then she passes those on to one of about 15 to 17 subject matter leads we have in the organization. So it's someone from the PFS function, it's someone from one of our labs, it's someone from one of our pharmacies, someone from one of our clinics, and she decides who is going to go to. Then it's that person's job to review the transmittal or the regulation. And by the way, we review somewhere between 600 and 800 of those a year. To review that and decide, A, whether the field needs some guidance on it, or B, whether it is something that we can really not pay much attention to because it relates more to what the carriers are doing or the FIs or something like that. But we have a process, and again, it's shared. All of these people, other than the one who has to read the Federal Register, don't reside in my function. It's shared, they review it, and they pass it through the organization. So we're trying to engage people with operational control, with functional control in our activities. Now, how do you get them to do that? Okay, that's a fair question, and that's something that took me a little while to figure out, but I have become a real fan of transparent reporting. Okay, so every month, I have a person who puts together a report that says this is the number of program memorandums or transmittals that have been sent to our subject matter experts. This is how many they've addressed, this is how many have not addressed, and that's sent out so that everybody who is in that role can see that. In addition, it's reported on a regular basis to senior people in the organization, so it becomes very clear very quickly who's not getting their job done. And the fact that we're transparently reporting that information, and I could go on for a long time, the information we're transparently reporting, that in and of itself really drives behavior.
This reminds me of something my friend Adam Turtletaub, that I think a lot of you know, said to me after the survey, that this reminded him of something a psychiatrist friend of his said. I'm sure it wasn't one he was in treatment with, but said that all stress is unresolved conflict. So what you've been discussing here as we throw out these stresses is, all right, let's discuss it. If you're stressful over having to keep up with all the regulations, look at some of the things, for example, you've done, Dan, about, okay, how do we resolve that? You're not in this alone. You don't have to do it all by yourself. Now, I want to switch. Shawn, did you want to say something?
I was just going to add, Dan's organization is profoundly larger than ours, and so our operational approach, we don't have an individual that can keep up on all the regulations, but we do contract with a company that provides a service monthly to us, and we have everybody in our system, 5 hospitals and I don't know how many clinics right now, all have the ability to participate, come on site, or they can access the information off of our website. And they give us an update of all the regulations that have come out in the past month by category. So if it's home health, DME, if it's related to provider-based billing, et cetera. And that is how we then facilitate those subject matter experts to go back to their entity and share the information. That's the only way we can work with it.
And let me add one other thing. I think the relationships that you develop with the people in this room are really, really important. Because, and I apologize, because I can only see about 2 rows or 3 rows back, but if I look across the front row or two, I see people like Steve Ortquist, who I've learned a tremendous amount from over the years. He's served in roles in health systems that, you know, we're in the same markets that we're in, and we've had the opportunity to talk, and you know, we've had situations where he would get calls saying, you wouldn't believe what Dignity Health was doing, or I get calls, you wouldn't believe what Banner or now Sutter is doing, and we'd had a chance to talk through these issues, and I'd find out that some of what he was hearing wasn't true, and he found out the same thing, but we also shared ideas about what worked and what didn't. And Al Josephs is right beside him, and Margaret Hamilton is right in front of me, and Marty Arvin is over to my left, and there are all kinds of people who over the years, simply through casual conversations, through meetings like this, that I've learned a tremendous amount from. So take advantage of the opportunities. Don't hesitate to pick up the phone and call your colleagues. Don't hesitate to pick up the phone and call me or send me an email. I enjoy it, and I learn as much from each of you as you're ever going to learn from me.
Well, I think that's one of the huge values of this organization. And you've got plenty of people out here to network with and learn about and call up. Speaking of that, all three of you are on the board, and I heard Roy say this morning that the board has had some discussions about this survey, and more specifically, going forward, how are we going to help our members? How's the board going to help our members and instruct the organization to provide some services that help with this whole stress situation and reduce that? So can you share some of your discussions?
I missed the last meetings.
All
It's
right.
all secret?
No. We're so stressed out with our list. We deliberated and talked for like 3 hours and came up with quite a lengthy list of potential stress areas for compliance officers. In January, we took a half a day and worked on this. And then we went back to HCCA and developed another work plan. It's in its draft form for what we can do to help serve our members better, such as articles, such as mentoring. Frank Sheeter came up with the mentoring idea, and we did speed mentoring on Sunday. I saw many of you participated. There's a total of over 508 meetings, essentially, that happened. We're doing articles. We are going to offer audio conferences. If you saw, we had a new track this year in how to be a successful compliance officer. We are able to flip that around and get a whole track developed, and that was in response to the stressors that were in the survey.
So at the January meeting, some of us volunteered to share ideas of stress relief, stress dealing, and what have you. I volunteered to do one, and we'll come out quarterly in compliance today with some ideas to try to share things that have worked for me or people that I know in trying to deal with stress.
And I would encourage you as members to send us your ideas, to tell us what you would like to see. We're willing to build the kinds of programs that would be helpful to each of you. We're willing to invest the resources as an organization that will enable us to deliver the kinds of mentoring, the kinds of coaching, the kinds of training, the kinds of education. But we really need to hear from you. We understand that we're all stressed, but we also need to hear what would be helpful, what would be valuable, so that we can serve you better and we can help you function more effectively in your respective roles.
I think I talked about accountability. I feel very passionate about what I'm going to say, and that is we, as a profession and as a board did this survey, and I think we knew many of the answers before the survey was tabulated, and that stress is very real and very problematic. We didn't appreciate just to the extent it was and how many people were considering leaving their job. Well, knowing that this job is stressful, we all have a responsibility to ourselves to learn how to deal with that stress and manage it. The job is stressful. Many jobs in America are stressful, and we get paid for that, and it is a job in a tough economy. So learning how to deal with stress is really learning how to take better care of yourself. And I just feel very strongly about that. I feel that if we look at health care and how expensive it is, and we take a look at our population, I mean, we're like Pogo. We've identified the problem, and it's us. Morbid obesity and illnesses that go along with that. We need to deal with that and take better care of ourselves. Finding something that you can do for yourself every day or every other day that is your time. And by doing so, you're adding some health to your program. For me, it's exercise. Sometimes I get to the gym at 8 o'clock at night, but when my patients say, "Gee, doc, I don't have time to exercise," I look at them and say, "Hey, if I have time, you have time." And so try to figure out what would be something that you could introduce to your life to help you deal with stress, to help you get through your day a little bit better. Every job is stressful. Ours perhaps a little bit more, but I'm sure if we surveyed others in our community of health care or elsewhere, they'd be under a tremendous amount of stress as well. So again, I'm sharing a passion, and that passion is be accountable for yourself. Don't leave your job because it's stressful. Find better ways to deal with stress so you can be there and perform your job. You've done a lot of training to get to where you are. It hurts me to think that that percentage is going to leave because of the stress.
Right.
I've had to learn how to deal with stress my entire career. I don't think there's anything more stressful than being a department chairman at at an academic medical center where the expectations of the leadership far exceed your ability to deliver.
I think you've come to what I was going to get at. For each of you, ask each of you personally, what do you do to take care of your own stress level? And I think the idea that we need to stop, breathe, and take care of ourselves first before we can help anybody else. So Shawn, what do you do to relax, to take care of stress? Become president of HCCA?
That helps a lot.
Good going.
I think self-awareness is key to some of the stress that can sometimes be self-induced, and I think Bob made a good point. Exercise is an avenue, but we each should be accountable for finding our own avenue. I do glasswork and play the piano. I tell my husband glasswork's cheaper in therapy. I don't know if I'm quite there yet, but anyway, I do that, and I've also come to realize that working 10-hour days, 6 days a week, does not always produce the best outcome or results. You're not proving anything to yourself or your organization, and I do better if I work less hours and take some time for myself and get outside. I don't do well being indoors that many hours of the week. So I do recognize that about myself after about day 2 or 3, and I've already got 40 hours in. I've got to do something to get out of the office and get outside.
Great. Dan, what do you do?
My life is changing. I have 3 children, and they're all out of the house, or largely out of the house now. I'm just working on getting them off the payroll, but first of all, I want to say, again, a couple things. One, I love what I do. I feel blessed every morning to get up and go to work and to be able to do what I do in a great organization, to work with an absolutely fabulous group of people. So I'm an extraordinarily fortunate individual. Second, surround myself with good people. Now, what do I do for entertainment? Most of you are going to think I'm crazy, okay? The majority of many of my weekends are spent going to estate sales, okay? I collect old tools, I go to estate sales, I buy old tools, I keep what I want, and I sell the rest on Craigslist or eBay or something like that. Now, some of you may think, like my daughter, who thinks I'm crazy going to estate sales, but as I tell her, people are dying to get rid of their stuff, so she shouldn't be too offended by it. But the second thing is I have a hobby, a place in Canada that I go to relax. But for me, really the most important thing is the second thing I mentioned, which is surrounding myself with good people. It makes your job so much easier when you have those. And in that regard, I've been extraordinarily fortunate.
Great, very interesting. Nice necklace you made, by the way, Shawn, in your hobby. Well, I think everybody needs to be thinking right now, it's okay to take time for myself. Because if you're not alive, if you're not healthy, you can't help do all these other things. Something you mentioned too, Dan, is passionate about this profession. And I know all of you think this, but for all the stress, I can't think of a profession to be more proud of than trying to help organizations do the right thing. So I think that passion in itself, we need to focus on what is good about what we do. And how do we help others do that? The other thing you mentioned is the HCCA. I mean, when I look at the number of people here, I think about then when we go back, I hope everybody remembers this, when we go back to our organizations and we feel isolated or maybe struggling with some things, to think about the time here. And that you can call somebody up. And something I always say to people in the SCCA academies I teach at, if there's anything to remember, when you're back alone and under stress and people are dumping things on you or you're not able to do what you want to do, and everybody maybe makes you think you're crazy, remember, you're not crazy. You're just a compliance professional. And this is perfectly normal, and there are other people for you to call up. Call up some of the people you've met. Those of you look around you and ask who's a newbie to the field, and reach out to those people and help this out. I think Jim Sheehan mentioned it, and certainly is the efforts of the HCCA. This is an organization, unlike many professions, where I think we really help each other and help out. Okay, so back to the survey. What did you want to expand on the survey? What's not there, or maybe was misunderstood, or not caught by the survey?
Well, I think in this industry, you know, one of our greatest fears is not what we know, but what we don't know. And so, to generalize, I would say that we know a lot now, but there's still a lot we don't know.
Right.
And I think the greatest is, how do we preserve the human resource, which is one of our greatest resources? How do we preserve all of that time and effort that our membership has put into becoming compliance professionals that now are so stressed out that they may leave? And we don't have the answer to that, but as a board, we're trying to work on helping people to deal with their stress. To me, it's just, you know, if there's a stress, to me, it's the fact that my new colleagues in this profession are so stressed out that they're thinking of changing careers. We need to figure out how we reverse that.
How much stress do you think is there? I know part of our profession is having to speak up at sensitive times, having to, what we call in the West, sit tall in the saddle when all around you are wanting you to do something else. I didn't necessarily see that in the survey. What's your opinion about, and maybe your own situations where throughout your career you've had to speak truth to power? How much of a stress is that just in our job description?
I think being the messenger can really be very challenging and difficult, but as both Bob and Dan have talked about, you can also turn it to a positive message. And I used this the other day in our healthcare reform talk with Frank. One of our audit reports revealed a very high error rate. So when I reported it to the board, I said, the good news is we have a 100% error rate with our findings. I got their attention. Their eyebrows came up, and I had a physician ask me, pardon, what did you just say? I said, we have a 100% error rate with our findings on our research billing. And he said, why is that a good thing? I said, because we found it, not the government. Okay? We want to find, we want to detect, prevent, and deter. And so they got a chuckle out of it, and they took the message very well. I said, we fixed it, we refunded, we're good going forward. So no harm, no foul.
I think one of the lessons in what Shawn had to say, and certainly in my experience, is that when you go to deliver bad news, you have to think through the message very carefully, okay? And I know in my career, I have learned that I need to address the problem and not the person, okay? I've had situations where I get emails, I uncover things, I get complaints, hotline calls, and my first reaction is, I can't believe you did this. You know, what were you thinking, okay? And all of us have been in that situation. But if I go to Shawn or Marjorie or my CEO or anyone else and my attitude is, I can't believe you did this, and my body language is, how could you be so stupid? How could you be that unethical? What's the reaction I'm going to get, okay? So one of the things I would encourage all of you to do is to do what I call practice difficult conversations. Figure out, go over and over again in your mind what you're going to say, how you're going to approach the issue. things of that nature, and it's very, very helpful. And I'll share an anecdote that some of you have heard perhaps a number of times. A number of years ago, after I was put in charge of overseeing our travel and entertainment expense reimbursement policy, and we had just changed the policy, I got an email right at the first of the year. It was the second hotline call of the year, and it alleged that our CEO had violated the policy by expensing a bunch of gifts. And so I thought to myself, great, that's just what I need, go down and have a difficult conversation with the CEO, right? And what's your temptation? The temptation for me is, do I really need to have this conversation? Okay? That's my first question, okay? Because you don't like to do that. And I work for a great CEO, and he's a great guy, but I still don't like to go down to the CEO and have those difficult conversations. But I know that's why I get paid. So I thought about it for a while. I didn't rush down there. I waited 4 or 5 days, and much to my, luck and amazement, another hotline call came in. Didn't relate to travel and entertainment, but it was somewhat analogous. And so I finally got up the courage, went down to his office, and I said, Lloyd, I want to talk to you about a couple things. I said, first of all, the hotline is working very well. And glad about that. And here's a situation that came up with respect to a hotline call, and here's what I think, here's the way I should handle it. What do you think? Absolutely sounds good to me, okay? Then I sprung the second call on him, and it was analogous, and the outcome was analogous. So what did I do, or what had I done? I'd kind of boxed him in a little bit, okay? But then I said, well, here's the problem that we have, Lloyd. We got a call to the hotline. It's alleged that you've done something in violation of the policy, and it's obvious that it's out, known within the organization, and we need to figure out how to address it. But before you start talking about how you think we should address it, let me do this. First of all, I want to apologize if the policy wasn't clear. Second, I want to apologize if I didn't explain the changes in the policy the way I should have, because I'd been to an education session with senior management about 5 weeks before. We'd gone over the policy changes. So I said, if I wasn't clear enough, I apologize. But I also know that this is out there and we have to figure out a way to fix it. And what was his response? He said, Roach, let me think about it, which is a fair response in my humble opinion. Now, some of us would say, I want a response right now, but that's a fair response. So I left the office. I'm sitting at my desk at 7:30 the next morning. I get a phone call. He says, Roach, get down here. I walk down to his office. He reaches in his pocket, pulls out a wad of $100 bills, counts off 55 of them, and says, I want an email saying we're square. Okay? That's the kind of CEO that I want to work for. Now, I did ask him, what am I supposed to do with $5,500 in cash? But that was another story. So,
What did you do with that money, Dan?
I got rid of it as quick as I could with an email from Treasury confirming that I turned it over to him. But the point is, take responsibility. Take responsibility for where we may have dropped the ball, where we may not have been as clear as we should have been, things of that nature. And I think if you attack the problem and not the person, you're going to get a much better response in most circumstances. And that's hard to do sometimes. I can't tell you how many times I've drafted an email, but fortunately I have a rule that if I'm annoyed or angry or irritated, I never send the email when I've drafted it. I've let it sit for 24 or 48 hours. And what percentage of the time do you think it is that I change that email?
About 100?
Or delete it. There you go. Virtually 100% of the time.
Now, what you just described seems to me goes to a stress issue that we have in this profession. We're expected to be a cop, but also the helper. And there are so many studies that show one of the biggest indicators that a company is going to get into trouble is if they have a culture where people do not feel free to report. So it seems to me the behavior you described is to try to get people on board, even if in difficult situations, to think, okay, I want to report, and it will be received in a positive way or a constructive way. So I would think that that's one of the skill sets we probably need to work on.
Absolutely. And you know what? Reading 800 hotline calls a year is not all that exciting, but it's important for the organization. It's important for the organization to be able to feel free to raise their concerns and their complaints.
Great. Shawn, have you had a situation where you've had a difficult situation? Or too
Yes.
numerous to name?
No, I will share one, and it does involve a physician, sorry. But, but it was, it ended up good in the end. We had an issue where our accounting department called me about business and travel, expense reimbursement for a physician. I hadn't met this physician, we had just acquired their clinic, and this physician had submitted receipts, and I said, then what's the issue? They said, can you just come over and look at these receipts? So I went over to the accounting department, and lo and behold, there is a receipt that was on 8.5 by 11 sheet of paper with a palm tree printed on it. Looked like one of my kids had, printed that on from the computer, along with an address and a date of where they were at in a tropical island. And the dates happened to be over Christmas, and it was for 2 weeks. And so I asked for a copy of the brochure of the program. I thought, 2-week program, that seems really extreme. I found out it was for an audio conference and wanted full reimbursement for the 2 weeks over Christmas. And the reason the receipt was a palm tree on a piece of paper is because there was an arrangement between him and his partner to pay for his condo in this island, and he was asking for a reimbursement. So my first encounter with this individual or physician was to take the bad news. But what I did was I sat down and talked to him about our policy, explained what our program is, and he did turn a little bit red and smiled, and he said, I get it. So it ended up good, but I think if I would have made a phone call, if I would have emailed and not made it personal, as Dan said, and explained, what our program is and policy, and as an employed physician, it could have not been so good at the end.
So, I had, excuse me, many, but perhaps one to share, but I'll preface it by saying I think one of the most difficult areas for compliance officers is to be comfortable with what I call the art of communication. And, I think all of us think we're intelligent. And one of my favorite points of leadership is, intelligence takes a back seat to common sense. There is absolutely no substitute for common sense. And that goes along with the art of communication. So there was a orthopedic trauma surgeon at Vanderbilt, and he was a rising star, had taken the Health Masters program, executive style, meaning the weekend program, and he was very brilliant as a surgeon, very brilliant as a rising star leader, but he had discovered a way to game our system, and that is that we do audits on people, and we give them a few chances to reform and take those opportunities for improvement and get better scores. And he found that, for a penalty fee, which was kind of small, especially for an orthopedic surgeon, it would do 100% review and do all of his coding. And he realized that, God, this was a bargain, that I could spend my time taking care of patients and operating, he could, and not have to deal with this little problem. And because of him, we changed our whole policy with an escalation so that even his pocketbook would feel a pinch. But along the process, I had to figure out, how am I going to talk to this young man that I had mentored and get him to buy in? And I approached him trying to use some common sense and said, look, you're doing all the correct steps to be a leader. You want to be a leader. Here's an opportunity for you to act like a leader. I want this fixed, and I want it fixed by next month, and I am tired of having to discuss your name to the Compliance and Corporate Integrity Committee at Vanderbilt, which is made up of leaders that are going to take a look at this one deviation from an otherwise excellent pathway and say, he is not one of us, he's not a leader. but it was the way I said it that I think inspired him. The message was obvious. The way of trying to get him to come on board was the key, the art of communication, and the idea that there is no substitute for common sense.
The other thing I would say that, in my experience, has been helpful in having the difficult conversations goes back to my notion of transparency. One of the things I try really hard to do, particularly if it's the kind of thing where I'm going to have issues repeatedly, and I know I'm going to have issues, maybe not with the same person, but the same types of issues, is set up a reporting structure where I am required to report things either to management or the board. And the reason I think that's important, I love to go to the board and ask them to require me to report certain things. And the reason I do that is because then it's not me being the bad guy. I'm simply doing what the board or management has asked me to do, and if you don't complete your travel and entertainment expense forms on time, and you get 3 letters from the organization and it still isn't done, then you get a letter from me, and at that point in time, I don't call them up and say, you're going to be fired, you're going to be in serious trouble, anything of that nature. What I say is, there's a meeting coming up on June 4th of the Audit and Compliance Committee. I want you to bring yourself and your CEO, your hospital president, your clinic president, whoever the case may be, and explain to the Audit Committee why you can't get your expense reports in. I'm happy to help you prepare that presentation. I'm happy to help you understand how the process works, that kind of thing, but you're going to have to explain to them why this is happening. Or I report on a regular basis who's not getting their corrective action plans done in their audits. And we have thousands of those each year, and they're reported in a way very transparently so that senior management in the organization can see, so every other hospital president or business unit leader can see how everyone else is doing, and so the board can see. And it really takes the stress off me, because these people, most of them, your leaders in particular, are competitive by nature. They don't like bad news going out about them, and it really makes my job much easier. They call me and say, Dan, how do I get my name off this list? Okay, I don't like being on this list. And then I can help them get off the list.
Well, it sounds like this raises in what all of you have said, the importance of making sure you have some very professional processes and policies and procedures in place so it doesn't become a personal kind of thing. This is the organization has decided this, and I am here to move this along. So I think part of the stress, unresolved conflict is, do we have policies and procedures in place for the areas that our organization is likely to have some of these troubles? That would take the stress off the individual. Okay, I'm going to try a lightning round kind of thing. They aren't aware of this, so we'll see this. This is part of the thing from the study was so many of in this profession are thinking of leaving. All right, now so here and so I bet there's some people here maybe thinking of leaving. Hopefully you've changed your mind after being with all these loving people in the last couple of days, but let's say they are, and let's say these are people we want to keep in the profession. So persuade them right now, stay in this profession. What are you going to say to them, Dr. Bob?
Well, exactly that. Stay in this profession. You have colleagues all over that will help you with difficult problems. But you made a commitment to go into this, to gain the education, to go through the, examinations or whatever, the training and the examinations, and you're a contributor. You're an advocate for compliance. How can I help you to stay? Just tell me what you need. I'll be there for you. I will help you. We need you. Your organization needs you.
Okay. Shawn, this better be good, because you're going to lose people in the organization here if they leave. You're the new president.
I would like to say that you make a difference, not just for compliance. You make a difference for patient safety, for quality of care and compliance. You make a difference for all of the patients in the United States. You make a difference for the government, and we get it right. And getting it right could be your health care, it could be your family's health care, it could be you. And so what you do every day is significant to your organization and to healthcare in general.
Great. Dan?
What I would say is I'd ask you to ask yourself 2 questions. Question number 1 is, do I like what I do, the kinds of things that I'm supposed to be doing? Do I enjoy doing that? If the answer to that question is no, get out, find another job. Life, frankly, life is too short, in my humble opinion, to be in a job that you really don't like. If the answer to the question is, I like what I do, but I'm in a very difficult circumstance, and I don't know how to fix that, then I think begin to talk to your colleagues. Give people in the organization a call. Give me a call and see if we can't figure out a way to help you be more effective in your job to address some of those challenges. You know what, though? There are organizations and there are people, I know this, who are very difficult to work for and very difficult to work with. And at some point, I think, as Dr. Bob said, you have to look out for yourself. And there's not going to be a silver bullet for every situation, but I think leaning on your peers, leaning on your colleagues, at least in my experience, has been tremendously helpful.
Great, terrific. I'm sold. I'm going to stay.
May I
Yes.
add one thing? Please realize that HCCA has identified stress as a major problem for all of you. You answered the question and just reinforced what the board thought. So this organization is committed as your organization to try to help you. And that's one of Shawn's missions during her presidential year, is to come up with ways, resources, and other that will help you to deal with that stress and continue in this great career.
Okay. Well, instead of me summarizing, I'm going to ask each of you, of all the wonderful things you've shared with us today, what's the most important thing you think you have heard or said today that you would, of all the things? And there have been some excellent suggestions. What would be the number 1 with you, Bob?
Take care of yourself. If you take care of yourself, then you're going to be in a better position mentally, physically, and other to deal with the stress of the job.
Mine is network, network, network. HCCA, just network.
Surround yourself with good people and trust them and rely on them.
Terrific, terrific. Well, one thing, I would like each of you in 1 second to turn to somebody next to you, introduce yourself, and tell them that you want them to stay, and you're going to engage each other. Let's go for it. Fantastic, fantastic. Okay. Okay, I know. Okay, I just want to thank my wonderful panel, and just remember, you're not crazy, you're a compliance professional.